Hello everybody, today we're doing clinical psychology with its first topic being schizophrenia. Now remember that clinical psychology is mainly divided into three parts for each topic: diagnosis, explanations, and treatments. So of course schizophrenia itself was using the same format. On the screen you can see that I'm basically outlining every single thing that you need to keep in your mind for this topic. The diagnosis includes symptoms, types of delusions, and we will also be talking about this key study of Freeman et al. Now you need to be able to remember all the details of the key study as compared to that of an example study. Like for example, if it's the procedure, the aims, and everything. So it's essential because questions do come in the past papers a lot. When we talk about the explanations, we talk about the biological and psychological explanations. Biological includes genetic and biochemical. Then we will be talking about the treatment as well, biological as well as the psychological treatment. The biological one includes the antipsychotics, both typical and atypical, and then we will also be talking about the electroconvulsive therapy, which is basically a shock therapy. Moreover, the psychological treatment includes CBT, which is the cognitive behavioral therapy, and we are going to talk about every single thing that I've mentioned on the screen in detail in the upcoming parts. Now we're moving on to the symptoms, but before I go into more detail, I'd like to let you know that schizophrenia is a very severe type of psychotic disorder, which means it's basically like a major break from reality, and that this individual with the disorder tends to perceive the world in a very different way than how others would. Now it's basically diagnosed using the ICD-11, and which was developed by the WHO, and it's basically a global standard for coding health information and includes both physical and mental health disorders. So symptoms are divided into two parts: positive and negative symptoms. Positive means that there is a presence of abnormality, whereas the negative symptom means that there is the absence of normality. Positive symptoms mainly include persistent delusions, basically individuals' beliefs that are not based on reality, hallucinations, these are sensory experiences that can be auditory, like hearing voices, or visual, like seeing things which do not exist. Then there's also the thought disorder, which is the inability to think and as a result speak in an organized manner. So the individual who has a thought disorder cannot speak properly. Then we've got experiences of influence, passivity, or control, which is basically the belief that one's thoughts or actions are influenced or controlled by someone or something external, and that this is out of their control. Now moving on to the negative symptoms, which include avolition, that is the lack of motivation; flattened affect, which is basically the lack of emotions or expressions; impaired cognitive function, that is reduced memory or attention; catatonia, that is the lack of movement or speech, where basically the individuals oftentimes find themselves in fixed, rigid positions. Let's briefly talk about this example case study done by Asia et al. In 2018, which was basically conducted on a boy who showed a decline in academic studies and general behavior from the age of 10. From the age of 12, he began to hear voices and believed that his mother, among other people, were communicating with those voices. So he was actually diagnosed with early onset schizophrenia. He would often shout at people who were not there, who would talk to himself, and his behavior actually became quite erratic. His self-care had declined and he would barely sleep. And so he was actually admitted to the hospital many times and was administered a range of medications to try and control his symptoms from getting worse. So he was eventually diagnosed with early onset schizophrenia, which is when disorders such as schizophrenia begin in childhood rather than early adulthood, and he was eventually released from the hospital once his aggressive behavior was kept in check through the medication. However, he still suffered from negative symptoms such as apathy, social withdrawal, and would often resist going to school. Types of delusions. Delusions, as I previously mentioned, they are beliefs that individuals hold which are not based on reality and can be bizarre, which means that they are almost impossible to be true, and non-bizarre, which means they can be true but highly unlikely. we're going to divide these into three main types of delusions: persecutory delusion, grandiose delusion, and the delusion of reference. There are, of course, other types of delusions as well, like erotomanic delusion, the belief that someone is in love with you. But we are going to talk about these three main ones. Persecutory delusion basically refers to when an individual believes that others want to harm them, they are talking behind their back, they're conspiring against them. Grandiose delusion, on the other hand, means that, these are beliefs people hold when they think that they have this special powers or abilities, and that therefore they do have a special purpose in life. And then comes the delusion of reference, where a belief that events in the environment are related to you, such as believing that a TV program is talking about you. Another thing that you need to know is that according to ICD-11, in order to be diagnosed with schizophrenia, symptoms must have persisted for at least 1 month and cannot be due to any other health condition or substance abuse or even due to any other medication. This is actually different from the DSM-5 diagnosis that states that the symptoms must persist for 6 months. Now moving towards the key study of Freeman et al. Using virtual reality to investigate persecutory ideation. Virtual reality is a computer-generated simulation where a person wears a headgear or uses special goggles and a screen or gloves to interact with a three-dimensional environment, keeping in mind that it's an virtual environment. VR was mainly used to investigate the spatial awareness and other cognitive skills such as social interactions. It has also been used to help treat psychological disorders such as phobias. People have also used VR to overcome their fear of public speaking, in which they interact with the virtual people in the simulation referred to as avatars. The aim of Freeman's study is quite straightforward. Freeman wanted to investigate whether participants without any history of mental illness would have persecutory ideations in a virtual reality environment. Now, as I've previously mentioned, that persecutory ideation or persecutory delusion refers to a belief that people want to hurt you despite there being no evidence to back this up, and this is one of the most common symptoms of schizophrenia. The sample of this study consisted of 12 male and 12 female participants who were all students or admin staff from the University College London, UK, with a mean age of 26 years. 21 were students and 3 were admin staff. None of the participants had any history of any mental illness, and the sampling technique was a volunteer sample because the participants had responded to an advertisement. Now moving on to the procedure of the study. The study was a correlational study where participants were trained on how to use the VR along with the use of questionnaires and semi-structured interviews. The virtual environment was that of a library, and they would be viewing the simulation for 5 minutes. Participants were unaware that their persecutory ideation was being observed, and instead they were told to explore the environment and to form an impression of the people in the room and what those people may think of the participant. The setup included 5 avatars, 3 of whom were sitting at one desk and 2 at another. These avatars would show different behaviors, including smiling, looking, talking to each other, etc. After the VR phase of the procedure was concluded, participants were asked to fill out the Brief Symptom Inventory (BSI), which is a 53-item self-report questionnaire to assess 9 symptom dimensions over the past 1 week, some of which include interpersonal sensitivity, depression, anxiety, hostility, psychotism. Sure enough, there were other questionnaires that measured aspects such as anxiety, paranoia, sense of presence, and specific ideations of persecutions. Now, these questionnaires were close-ended with ratings such as from 1 to 4. For the VR paranoia questionnaire, there were 15 items, ratings from 0 to 3, from do not agree to totally agree. Along with this, semi-structured interviews were also conducted. Half of the participants, even number of males and females, took the questionnaires before the VR task as well as once again after, whereas the other half took it only after the task. The results tell us that there was a significant correlation between scores on the paranoia questionnaire and the paranoia score in the interview. Most of the participants had positive opinions of the avatars, but a few had ideas of persecution. An example of this is for the item "They were talking about me behind my back." 11 of the participants did not agree, 8 agreed a little, 3 moderately agreed, and 2 totally agreed. There were no significant differences in the persecution scores for males and females, or those who took questionnaires only after or before and after the task. Persecutory thoughts about avatars and paranoia scores did not have any significant correlation. Higher levels of interpersonal sensitivity and anxiety were significantly correlated with high levels of persecutory thoughts in the VR. Now, Freeman concluded that people do attribute mental states to the VR characters, and although they are usually positive, they can be persecutory in nature. He also concluded that people are more likely to show persecutory ideation if they show high levels of interpersonal sensitivity or anxiety. Here are some examples of results for some items. Now, this is all for today's video. We'll be continuing with the explanations and treatments in the next few parts.